I'm Ozlem Goker-Alpan. I am the Chief Medical Officer and founder of Lysosomal and Rare Disorders Research and Treatment Center, in short LDRTC. LDRTC is the host and organizer for GRIDS Symposium. We are celebrating the 10th anniversary of GRIDS this year. We are very happy, and not only happy, but we are also excited that we finished a decade, and GRIDS has evolved enormously from the first meeting that Roscoe Brady gave the opening statement and the inaugural lecture. Now we're looking into a meeting where multiple expertise and multiple specialties come together. That includes engineers, aerospace scientists, cell biologists, and physicians to discuss a specific topic and then develop collaborations and actually produce knowledge at the end. Few missions of LDRTC, we address it here. First is we want to produce equity in knowledge and dissemination. And this mission has been accomplished by actually the help of CheckRare. If you look at the attendee list, it's about 200 people. It's a small meeting. But then what happens is, with the enduring part of the meeting that is available to all the audience over internet, so we expand actually our audience to more than a few thousand people. And this extends to almost all the world. I mean, we had attendees or listener or audience from Tibet, Nepal, Middle East, Europe. So basically we're not really limiting ourselves to Washington DC metro area, which LDRTC is housed at, and then we hold actually this meeting there too. But to almost like a universal meeting that the knowledge can be extracted and be used for not only for the science purposes but also patients. The other thing that we want to establish at the GRIDS is this ongoing collaboration and producing new ideas with these specialties. The reason is, if you look at the physicians or scientists, you know, we have, especially the ones that we invite here, they are very much specialized and have expertise in one area. But what happens is, like, we almost cocoon ourselves with maybe sometimes with our beliefs and biases and this and that. We follow the literature about that topic, and we don't really necessarily expand our horizons. That will still be in that expertise, but including these techniques like from an engineering or aerospace scientist, or also look at the similarities and differences of per se lysosomal disorders that will give us ideas about drug development and pathophysiology, so on and so forth. Obviously, this is an evolving meeting and a conference, and we still want to keep it small. I think the intention is never to have this 5,000 people attending in the same venue, because those meetings, even though, you know, I stopped attending those meetings. The reason is it is maybe too much information, and then some information are redundant, and some of them you don't need it, and some of them actually are repeated in multiple meetings. So what we do is we choose a topic that actually comes from the audience, and we evolve this to the most cutting edge, either the speakers or the technology happening, and we invite them to this meeting so that, you know, next meetings the agenda is born. I think we want to still follow the same format here. Whatever is happening, I think this meeting needs to be a reflection of not only in one lysosomal field, but multiple fields that come together and help lysosomal field and per se the patients. I also want to a little bit discuss about the GRIDS clinic. At the end of these 2 days, we invite the experts that take, the clinicians and the experts that take a role in the GRIDS agenda, and invite them to see some challenging patients that we see in our clinic. This year we want to do is on Fabry disease. We have two very famous Fabry experts from different parts of the world. So this not only a great opportunity, and we have trainees here too, a great opportunity for the trainees. You will never forget such a thing in your entire life, but also this is a great opportunity for the patient who has the ability to ask questions to worldwide expert, otherwise they won't be able to have the opportunity. And one thing is with these rare disorders, how the medical world works or clinical world works is unfortunately there is very little time to spare for the patient in the clinic. So this is fortunately almost an infinite format for the patient to interact with the experts and ask questions and know about what is going on. So we want to actually continue with this too. I want to a little bit discuss who we are as LDRTC is. So we started, this center is a freestanding center. We are quite small in size, but I think we are very robust what we do, meaning we do translational research, we do multiple clinical trials. We currently have 4 or 5 gene therapy protocols, and we usually dose the first patient, and we can actually start study in a very, very short time. I think that being small gives us the opportunity to do that. In that case, we also accept patients from all over the world and all over US. We are not limited with the insurance or geography. Part of my administrative team works for the financial hurdles to bring in the patients, so we can actually offer them whatever is happening as the most advanced therapeutic protocol or diagnostic procedures are available to that particular patient. So the other thing is, as I said, in an academic setting, hospital setting, we usually have very short time to devote to a patient, which actually doesn't do justice for this very rare disorders. As you talk to the patient, usually that the main focus changes and you have multiple issues that needs to be addressed. In my clinic, in our clinic, we have an appointment time that starts. We don't have an appointment time that ends. So basically it can be a whole day, and if the patients or the family wants to stay, we can actually have a whole week, meaning these patients are very, very sick, by the way. So there is not one single thing that will make the patient better. So there are usually multitude of things that we need to address. So half an hour, 1 hour, 3 hours even is not enough. It may take a few days to understand the real problems, develop actually a diagnostic and therapeutic protocol, and then at the end discuss the findings with the family and also have a follow-up evaluation. So given that, we had quite a success. So our patient population now is about 500 patients or more in our database with different lysosomal disorders, and that we provide care, treatment, and follow-up.